a video on how to use a thermal ablation device. I'm Dr. Katina Robison. This is Dr. Lindsay Beffa. We're gynecologic oncologists.
The purpose of this video is not to replace comprehensive in-person training on how to screen and treat cervical precancer and cancer. Our goal with this video is to teach you about how to use the device, the different parts of the device, how to clean it, and some tips and tricks about the device.
The benefit of using a thermoablation device over cryotherapy is that with a thermoablation device, you do not require electricity. It can be used anywhere, it's portable, it's light, and it does not require any gas.
Thermal ablation works by heating to 100 degrees Celsius in order to desiccate or destroy the epithelium and underlying stroma. Thermal ablation devices, also known as cold coagulators or thermocoagulators, are used to treat precancerous lesions of the cervix. This includes only cervical lesions that are entirely visible, meaning that they do not extend into the cervical canal, lesions that appear low grade on screen and treat methods or histologically proven CIN 2+, and cervical lesions that do not cover more than 75% of the cervix. There should be no scarring of the cervix or polyps that would not allow for full contact of the device with the cervix. It is also important to ensure that the patient does not have cervicitis.
The thermoablation device comes in a carrying case like this one. We're going to walk through all the parts of it, how to assemble them, and all the tips and tricks. First, you want to take the locking tabs and open the case. Inside the case, remember, it always comes with a manual, which is important to review prior to assembling. So let's now review all the components of the carrying case. This is the handle and the charging battery. Here's a spare battery. This is the charging cord for the battery, and these are the probes.
The thermocoagulator comes out of the packaging non-sterile, so before you use it on a patient, you need to clean and disinfect the device.
We're going to start with the handle. I'd like to orient you to the handle and the face of the handle. This is also known as the LED display. When we turn on with this button, it's the on-off button, also known as the activator button. You're going to push it, it will turn green, and you will see flashing blue lights. These will not stay on because a probe is not inserted. On the bottom, there's a low battery indicator. If you see this go on during a procedure, that should be your last procedure, and you should change the battery prior to the next procedure. The battery has releasing tabs on either side so that you can bring the battery out and put it back in. And it needs to snap. When this low battery light goes on, that signifies that that should be the last procedure that we use this particular battery for. Again, place your fingers on the releasing tabs and remove that battery. At this time, you then need to take the battery charging dock off, put it on your battery. Now, there's a little area here. You'll take your charging cord out of the case, and you want to insert that cord into the charger. When that happens, this light will turn green. Then you want to make sure that you plug this into an AC outlet. Depending on the country that you're in, you can use an adapter with this charger. The green power LED light should illuminate when the battery is placed into the adapter. Make sure that then you plug this in to an AC outlet, and it can accept 100 to 240 volts. When you plug in to your AC outlet, you will then see that the LED light illuminates red. The battery usually takes around 2 hours to completely charge. It is okay to leave the battery charging overnight for longer than the 2 hours. So it is important to remember when traveling to areas that do not have electricity to charge the batteries fully before using them. Once the battery is completely charged, the light goes from red to green. In addition, the battery cap has an LED light that can be used as a flashlight. The probes are the part of the device that actually has contact with the cervix. In this particular carrying case, it comes with 4 probes, but 3 different types of probes. There is a small 16 millimeter probe that is flat, and in addition, there are 2 19 millimeters. One is flat, and one, as you can see here, has a little tip. This is the one that's often used, as that tip can go into the cervix and ensure that you have connection with the entire cervix and the portion that you want to treat. In addition, the probes have a cap at the end of them. This cap needs to be removed first before it can then be inserted into your handle. You must hear a click to know that it's actually properly inserted.
Please note that if the probe is not attached at all, or is not secure, or is broken, when the on-off or activator button is pressed, the unit will power on briefly, flash all lights 3 times, then shut off. Another tip is that when the on-off button is pressed down for 2 seconds, the device enters into exam mode and will not be able to perform thermoablation while in that mode.
Then, again, we're going to use the on-off button to turn on our thermocoagulator.
When you want to use the thermocoagulator for a procedure, you press the on-off button for about 1 second. Pressing and releasing too quickly may fail to power on the device.
And what you can see here is that now the green light stays on, and we see that we again have the LED blue light flashing, and we do not have a low battery indicator light showing. Additionally, once that probe is connected, you can see that we have an extra LED light that is showing so that we can see into the vagina when we're performing the procedure. Once the probe is in and we turn on the handle, this tip is still not hot. We can touch it and it is safe. When we're ready to do the procedure and we have inserted this into the vagina, you then push this button one more time, and as you can see, the LED lights start to go, showing that it is heating up the tip. Once the tip is completely heated, you will see all 4 lights showing, and that means it is time that we can start the procedure. Now it's heated. As it goes down slowly, you'll see that that's the treatment time. And once you see no bars, it means that the procedure is completed, which is typically around 20 seconds for that treatment time.
Ensure that you have placed the patient on a clean table with stirrups. Ensure that you have a new clean pair of gloves. And now we're going to review again how to assemble the device. I'm going to take the silicone cap off of the probe. Place it in the handle till you hear the click. At this point, I'm also going to inspect the device to ensure that it looks like it has been sterilized and cleaned properly before using it on the patient. Later in this video, we will review how to properly clean and sterilize this device. I'm going to test the handle, turn on the activator button by pressing the on-off. As you can see, this has turned green, the one blue light is blinking, and our lights have turned on. This is now ready to use, and it is still cool. I will then describe to the patient and tell her what I'm about to do before doing it. I'm going to touch the patient, place the speculum in the vagina to visualize the cervix. Once I have an adequate view of the cervix, while the unit is still cool, I will place the probe tip flush against the cervix. You can see I'm using the conical or nipple tip probe. This is placed directly into the endocervical canal. I'm going to place this flush against the cervix. Before I activate the device and make it start heating, I will ensure that I am not touching any other tissue of the patient, including the vaginal sidewall. So again, one blue light, the probe is cool and ready for use. Once I feel like I have a safe and the placement is adequate over my lesion, I will then press the activator button again to start heating the probe. It is important at this point not to move and to ask the patient to remain still. The unit is now heated and treating the tissue. Every 5 seconds, one blue light will be removed, and this allows you to give the patient an adequate assessment of how much time is left in the procedure. With that longer beep, the treatment is now complete. I will hold this in place as the unit cools down before removal. Once the white LED lights in front shut off, that means the unit is cool and safe to be removed from the patient. Now we're going to review what the actual treatment area appears like. Again, we're going to turn on the activation button. It turns green, one blue light, and our front white LED lights are on. This is ready to use and cool. I will then place it against the treatment tissue. In this video, this is a piece of chicken, just to demonstrate the results. When I am ready, there's no other tissue contacting the probe. I hit the activation button again. The blue lights will begin to scroll. The probe is heating up. The tissue is now being treated. This takes approximately 20 seconds. That longer beep tells you the treatment is completed. Now we're just awaiting the cool down process before removal. The white lights have gone off. The probe is cool and ready to be removed from the patient. As you can see on that treated area, I used the nipple tip probe, which is the most often probe used as it includes the cervical os in the treatment area. And again, there are different sizes, so you can determine what size is appropriate for your lesion. In this next demonstration, I'm going to use a 16 millimeter flat probe so you can see the difference in the treatment areas. I have turned the unit on. It is still cool. There is one blue light flashing. I will now place it against the lesion in the area that I want to treat. While holding it steady in place, I will hit the activation button again so the unit begins to heat. You can see the scrolling blue light demonstrating that the unit is heating. And the tissue is now being treated. The treatment is complete, and now I'm just awaiting the cool down process before I remove the probe. The white LED lights automatically go off, and the probe is cool and safe to remove from the patient. So as you can see on these two different treatment areas, the conical nipple tip probe was used here, and this was a 19 millimeter probe. Again, this is the most commonly used probe as it includes the cervical os in the treatment area. If you have a smaller lesion that does not involve the area near the os, you may decide to use the smaller flat probe, the 16 millimeter flat probe. And you can see the differences here.
Once you've completed the procedure, then to remove your probe,
If this were a real procedure, you would be wearing gloves while disassembling the device.
you once again pull it out, and it's very important to remember to replace the silicone cover prior to disinfecting your probe.
Now we're going to go through the cleaning and disinfection process. This process is important to keep the device functioning properly, to prevent any unnecessary wear and tear on the device, but most importantly, to prevent any disease transmission between patients. If the cleaning and disinfection process is not done appropriately between every patient, there is the possibility of transmitting certain infections such as HIV, hepatitis B, and hepatitis C between patients.
It's important for the cleaning and disinfection process that you have all the appropriate materials before you start the process of cleaning and performing these procedures. So first, as a reminder, always have gloves. As you do the cleaning, it's very important to make sure you're using gloves yourself so that you protect your hands. We also want some type of disinfectant wipe or some cloth that you can do a wipe down of all of the different items prior to going through. Now, it's important, if you can, use sterile water or boiled water. The first thing you'll want to do is disinfect the speculum. Whether they're reusable and you're using them again or whether they're metal, you always want to disinfect these. You want to take them apart, and then in the rinsing bucket, you're going to take your brush and you're going to remove any debris on both pieces of this speculum. Then you're going to rinse it off, and you're going to put these in your glutaraldehyde solution. You're going to let them sit in the glutaraldehyde solution for 30 minutes. Once 30 minutes has gone by, you're going to take them out of this solution, and then you're going to thoroughly rinse them, again in sterile water if available, or boiled water. After rinsing, you'll take it out, and then you want to leave them and allow them to completely dry before using them.
So now we're going to review and pretend that we've just used this device on a patient. We're going to first disassemble the handle, take the probe off, take the battery out of the handle. One very important step, ensure that you place the silicone cap completely over the metal tip of the probe. The pieces, such as the handle and the battery, that cannot be submerged in water need to be wiped down with a disinfectant cloth.
For the Liger Thermocoagulator high-level disinfection process, there are 5 basic steps: cleaning, short soak, rinse and inspect, long soak, and final wash and dry. The first step is cleaning off the probes.
Now for the probe. Again, the silicone cap is tight over the metal tip.
Next, rinse the probe shaft using cool running water to remove gross soil. Use a soft bristled brush or cloth to aid in the removal. Run water over the shaft, crevices, and hard-to-reach area until the water runs clear. It's important not to use anything abrasive to clean the probe. For the second step, which is a short soak of 1 minute, you need to prepare an enzymatic detergent such as Enzol per the manufacturer's recommendations. Fully immerse the probe in the prepared detergent.
You're then going to move it into your glutaraldehyde solution. You want to ensure that the entire probe is completely submerged.
Allow the probe or probes to soak for a minimum of 1 minute. Following the soak time while still immersed, use a soft bristled brush or cloth to thoroughly clean the probe. Pay particular attention to hard-to-reach areas. The third step, rinse and inspect. Remove the probe from the detergent solution and rinse with running water. Visually inspect each probe for visible soil. If soil remains, repeat the cleaning procedure. The fourth step is a long soak. Again, assure the silicone cap is on the probe connector. Then immerse the end of the heating tip of the probe into a cup, not a basin, of disinfectant solution that's approximately 5 inches or 12 centimeters deep. Make sure that the heating end of the probe is facing down into the disinfectant solution. Allow the probe to soak that way in glutaraldehyde following the manufacturer's guidelines, for example 20 minutes at room temperature. The fifth step is the final wash and dry. Thoroughly rinse the probes in pure water, agitating and allowing them to set probe tip down in a cup of pure water for a minimum of 5 minutes.
And again, you want to rinse with sterile or boiled water ideally.
Repeat the previous rinsing step 2 more times for a total of 3 rinses using a fresh batch of pure water each time.
And then you want to leave it to dry completely before using again on another patient. The other option is using a sterile cloth to dry the probe as well.
Dry with sterile lint-free cloth, and finally store in sterile lint-free cloth until the next use.